Hello, I'm Dr. Laura Fenimore, and I'm really delighted today to have us listen to an interview with Dr. Victoria Reiser. Vicki is one of our recent graduates of the nurse practitioner program here at Pitt, and Vicki's specialty was in the world of adult and geriatric care, specifically as an acute care nurse practitioner. And so, Vicki, welcome. Thank you for joining us today. And now I'd like to have you tell us a little bit about your current role and your scope of practice.
Sure. So now I'm working inpatient as a nurse practitioner on our bone marrow transplant service at UPMC Shady Side. And so I do have a good deal of autonomy and I fully collaborate with our attending physicians. I do prescribe and make plans of care in collaboration with them. Um, Granted, in PA, we do have to have a collaborative agreement, but I do admit patients under their name with them, but I fully admit them and also create their care plan, like I said. And after the physician has completed rounds, I'm really the one that's there all day managing patients. It's similar to the resident or the fellow on the floor. I'm that first call and the one that is directly working with the nurses, with the patients,
Mhm.
and follows the patient from the time that they're actually admitted. We tend to have our own patients that we will admit and then follow throughout their transplant, and even when they're admitted for complications, that's my patient. So
Great. So tell me a little bit about how you got to this point. What was your journey like to this new role as an acute care nurse practitioner? Did you know you wanted to be an NP when you were a brand new student?
I did. I remember starting nursing school at WVU, and I knew I wanted to be a nurse practitioner. I didn't know that I wanted to go into oncology or be with adults at all, but I quickly learned that pediatrics was not for me. But I did have a clinical rotation on our oncology unit at West Virginia at Ruby Memorial, and I really fell in love with the population and the care that we were doing. So fast forward a little bit, worked on bone marrow transplant as well during that time and knew that's where I wanted to end up. So I chose Pitt because I knew Pitt had an acute care program, which was extremely important to me. I knew that that would serve me best to better serve my patients due to what we learn as far as understanding critical care medicine and hospital-based management of some complex and critical problems. And then Pitt also had an oncology clinical emphasis, so I could get as many clinical hours as possible in oncology and cancer care. And so that's how I ended up at Pitt and chose that program.
Excellent. You and I share our undergraduate experience. I'm a West Virginia grad as well and came to Pitt for my master's. I always tell folks, don't hold that against me. You
I
know,
know, I
depending
say
upon
the
which
same
school
thing. Yeah.
I'm with as the backyard rivals that we certainly are. Um,
Hmm.
Tell me a little bit about the kinds of clinicals that you had as an oncology acute care nurse practitioner. What was that like, and what kinds of things did you do?
Sure. So starting out, we always have the differential diagnosis clinical that's med surge type based, general problems, and hospitalist service. And then moving forward from that to another hospitalist type rotation. After that, we have a very unique experience at Shady Side where we have a department within the oncology service that is specific for oncology patients. So there are nurse practitioners and PAs who work there who actually used to work on our different oncology services who now staff that. And lucky enough, I get to actually start training for that in January timeframe to cover a few days. But so I did a summer there and learned so much because it really brought in the internal and the emergency medicine together with oncology, which was a very unique and very fast-paced experience. After that, I decided to do an outpatient rotation at the Hillman to see what that life is like because I have never been outpatient before. And it was a really good way to understand the process on that side of things, outpatient treatment, the process of admitting someone from outpatient to inpatient if there's a complication or an unexpected event. And then understanding too on my end, now that I'm inpatient, how my communication has an impact on their follow-up
Mhm.
afterwards. I also learned I did not like that side of things, so that was also a good way to do it. Um, After that, my last semester, I did some time with one of our nurse practitioners who has a load of experience both on our lymphoma service, leukemia, as well as bone marrow transplant. And I did some critical care time as well at night, which
Mhm.
was really nice because the nurse practitioners had so much autonomy. I wasn't really competing for time with between the residents and the fellows, which can be a bit challenging. And what was interesting too is this group of nurse practitioners followed our CAR T cell patients at night, so I was able to get that side as well. So I that was all of my clinical experience, and I always wanted more. I felt like I wanted more all the time.
Did you feel prepared when you finished the program?
I did and I didn't. I think that
Mhm.
I
That's a
really
fair answer.
felt that the program really did prepare me very well to step into my role, and I was just very anxious, I think, but I had such great clinical experiences that I selected on purpose because I knew what my end goal
Mhm.
was. Um, I also feel that working as a nurse before and throughout school was helpful to understand
Mm.
the ins and outs of working in the hospital. But the fact that all of our professors, instructors were so engaging and open to questions and really encouraged us to seek as many opportunities as possible um, helped me to feel very supported and prepared.
Mhm.
So I really do, and I'm not saying this in a negative way, but I always feel that PIG grads are better prepared than other grads that I've seen.
Mm. Well, as a faculty member, we love to hear that. So thank you. I appreciate that. And I swear I didn't pay her to say that as
Nope.
well. What I really liked about your couple comments that you made, Vicki, is you talked about finding out what you didn't like. And I think
Mhm.
that's really important, and particularly for nurses who are just starting in their careers, that they may have a variety of different kinds of jobs. And in that process, and in their clinicals, they may be exposed to populations that they like better than others. Like you found out you liked adults better than taking care of kids. I was like
Mhm.
that too. I like taking care of well children, but sick children, too much. Couldn't do it.
Mm-mm.
That wasn't for
Yeah.
me. Um, and that you also like the inpatient environment as opposed to the ambulatory setting as well. And some of those things you don't necessarily know when you're starting out and getting ready to go into that. You did a scholarly project as a part of your DMP practice. So tell us about what you did in your with your scholarly project.
Right. So my project was related to women with metastatic breast cancer, and it was the symptom education and advocacy program for these women. And essentially what I did was I helped to settle up the final pieces. I was very lucky that this program was in existence or building but hadn't been implemented yet.
Mhm.
But my goal was to see how this program affected distress scores, anxiety, symptom management, and even referrals to palliative care and social work for women with metastatic breast cancer. And so it was a rather lengthy process because there was some time where I had to do some literature reviews and help support this project getting implemented to prove that it was needed.
Mhm.
And moving forward from that, really digging in and going through the IRB process because this was looked at as an actual research study, which most of these projects are when we're
Mhm.
proposing them rather than QI. And then learning how to really get into a database and search through the data. And that was really the most tedious or most time consuming of everything was
Mhm.
knowing where to look and how to do these things, but also just the how to communicate with different groups and understanding this style of academic writing rather than kind of how we used to always just write reports. It's very different. Scientific writing is very different. But luckily enough, this program was excellent, and we saw some really good significant changes positively, where women were reporting decreased distress, decreased symptom scores, anxiety, and our referrals went up as well. So then moving forward after that, working with the statistics department, I think too, that was something I was afraid of. Was I had a statistics course, but I am no statistician. But it's really just being able to understand and read the statistics rather than do them as a DNP. So that was a huge relief, and everything went actually so much more smoothly than I even thought it would. But also then moving forward after that, writing the paper, and that was also a very interesting experience. And I learned a lot about, we're used to, like I said, doing these long, very research papers with a lot of background and knowing how to write things concisely, but also carrying an argument, but still just show the facts. So, and then knowing how to receive feedback in a good way is very difficult with a journal. But the biggest lesson was patience and starting early. I think we're talking to first year students now, and if you have an idea now, I highly recommend jumping on it as soon as possible and working as early as possible, because then you have the time to be deliberate and thoughtful about your work so that it's not rushed and you're not very worried towards the end of the program about finishing it.
Excellent point. Tell us a little bit about what a typical day looks like as a acute care nurse practitioner. What do you do all day?
When I read this question too, I thought, is this my entire day or just when I go to the hospital?
Would be the hospital focuses.
Okay. Yeah. So I get to work before, our shifts are either 12 or 8 hours, depending on the day. But for example, on a 12-hour day, I try to get there between 6:30 and 6:45 because I want the extra time to review my patients. And I am one of those people too. I get my emails to my phone just so I can see who my patients are the next day, which is really nice. We get an email with a split and then a sign out so I can do a quick peek and be prepared for the next morning. But yeah, so I get there a little bit early and print off all of my progress notes for my patients so I can go through and understand the plan for yesterday and then moving forward. And I quickly learned that I needed to just have a checklist that would keep me on track because there are so many moving parts. And I think too, we probably all did this as nurses. We had some sort of mental checklist, but now it's even bigger. So I actually have this little index card with my checklist in front of me. So I go through all of that, and then based on their needs and their acuity, I do make a plan and start putting in orders that I can do prior to collaborating or getting the physician's feedback on them. I round on my patients prior to rounds with the physician. And I really enjoy this time because it's still my time to have that nursing side of things and really develop a rapport with my patients and understand how they're doing and give them some teaching. And also build on the plan I'd already made, because so many things change within just a couple of hours, or understanding what maybe they're going to need tomorrow, or discharge planning and that sort of thing. And then how we do rounds, it seems a lot of services are different, but we sit down in rounds. And then we walk after that with the physician. The rest of my day is really placing those orders that we wanted to talk about together, writing notes. And I've found that PIT really, really helped me with note writing. It's the most critical thing probably you can do if you're transitioning a patient. Like, for example, when a patient goes from the floor to the ICU, and the ICU can look at that note and know what the plan is supposed to be for them, especially when you're in a specialty that's pretty unique and the communication or the terminology is so different. But yeah, so just managing the patients as the day goes along as well. And I always go back and do an afternoon rounds to see them, again, to build that rapport, but also just to see how they did throughout the day based on the interventions that we did. And also to see the nurses, because that teamwork is a critical thing too.
That's a great answer. You know, I'm an oncology nurse myself, and many times people would say to me, "Why oncology? Isn't that sad?" And I'm like, no,
I know.
very hopeful in many cases. But tell me how you would answer that question. Why oncology?
Oncology because I I always go back to a couple of my first patients that I had who had end stage disease, and so they were still battling their cancer and putting up a good fight. But at the same time, there's a very holistic approach that
Mhm.
should be taken and is being taken. And you're treating not the patient but the entire family, which is true throughout the board, but I think that it's a little bit more so in the oncology space.
Mhm.
And I was also able to develop a longer relationship with my patients. And I learned how to kind of integrate wellness into a very critical setting, which I really am passionate about as well.
Mhm.
And there's a big movement of integrating primary palliative care, which palliative care is the symptom management side of things. It's not just end of life, which unfortunately is kind of how things are twisted
Mhm.
sometimes, or not twisted, but misrepresented,
Mhm.
because palliative care does encompass end of life and hospice, but it's not the only thing. So I found this little niche that I just really, really like. And it's the palliative side of things actually makes things hopeful because it does help people feel better,
Mhm.
and shows that people can go through longer treatment actually and have a better quality of life, even if they do have an end stage disease. So that's a long way to answer why oncology, but I see it as a way to help people continue to live as well as they can when they have something that's really, really terrible.
To live as long as you can for as long as you have
Mhm.
is an important concept in palliative care.
Yeah.
So, as an acute care nurse practitioner, kind of looking back, if you were to offer some advice to a student who was thinking about this role, what advice would you offer them?
I would first have them ask why they're thinking about it.
Mhm.
And that's it. Just really sit down for a little while and ask why. Take your time. But also just shadow as many different acute care NPs as possible, because there are so many options. At first you hear adult gerontology, acute care, nurse practitioner, and you think it's very pigeonholed, but it's
Mhm.
not. And so, like I said, I was outpatient, I was in the ER, I was inpatient, and every role was so different. And so that really, if you don't know what you want to do, that's a great way to do it. Um, and what was my other point I wanted to make? But in the end, also just networking and building a
Mm.
network of people throughout, like a hospital organization or within your community, because that's going to help you get into places down the road when you're looking for a job.
Mhm.
So.
And so, one last question. What are you most proud of so far in your young career as a nurse practitioner?
um, I It's funny. I had so many good experiences at Pitt that it's hard to pick one thing. Um, but truthfully, I think it's my DNP project, because it's been a very good stepping stone to other opportunities that are leading me towards um, what I'm really passionate about. And so I did
Mhm.
that project on symptom management, and it led me
Mhm.
to an opportunity after school. I'm still writing a paper and working with a palliative care physician, and I learned a lot about primary palliative care through her, and now I'm proposing a project um, to hopefully implement that in our BNT service. And so I think I'm very proud of the accomplishments that led me somewhere else, if that makes any sense.
Makes a lot of sense, Vicki. And I really want to thank you for sharing your journey with our students and prospective students, perhaps in the future. I think you have a bright and promising career ahead of you, and I frankly can't wait to see the places you'll go. Thank
Well,
you
thank
so
you for
much.
the opportunity.
You're very welcome.